Hi, Jen.
Hi, Monet. How are you?
I'm good. We're in the middle of summer break here. So, as you can imagine, we have kids at home and we are recording and sometimes like less than optimal situations. So, right now, all four of my kids are upstairs and I've told them to be quiet, but hopefully, we won't have too many noise interruptions. But if you hear something falling or a child screeching, don't be alarmed. It's just my kids. And yeah, we're super excited to be chatting together today.
Absolutely. And my little kids are home too. And we also have a very loud puppy. So you're going to hear some stuff today for
Lots
sure.
of noise. Jen and I
Yeah.
were joking and said we wish that we could record these podcasts while we were both on our walks. We often walk and talk together, which allows us to get away from the craziness of home and have some quiet time. But obviously, it's not the most ideal podcast recording situation, but maybe one day we will just record our phone calls because that's often when we have the best conversations. But we're going to go ahead and start chatting about our topic today. And we are so glad all of you are listening. It's been super exciting and wonderful to receive all of the feedback and the emails. We're so glad that so many of you have followed us, and we can't wait to share more.
Yeah. It's been really fun to hear all of the feedback for sure. Especially since it's so personal. Like these were our birth stories and people have commented on those. And I don't know. I've really enjoyed it. We really waited so long to finally do this. And I'm excited to finally be doing it. So.
Yeah, me too. Hi, it's Monet and Jen, and we are the co founders of Birth Becomes You. We are birth photographers and doulas with over 10 years of experience. We've attended over 1,000 births collectively. We started Birth Becomes You to create a safe space for new and experienced birth photographers to share and grow. We aim to equip and empower birth workers to feel confident in the birth space and take beautiful, world changing images. We believe in a world where birth is visible, where shame is absent, where fear is translated to power, and where each individual's experience is honored as valid and valued. We are so glad you're here, and we can't wait to learn and connect with you.
We are so glad that you joined us for the debut of our podcast. And to thank our first listeners, we are offering an exclusive promotion of 25% off any item in the shop through the end of July. So through July 31st. To redeem it, you can go to birthbecomesyou.com and click on the shop in our menu and use promo code podcast25 at checkout. That's promo code podcast25 when you check out. We have tons of items in the shop that include toolkits and contracts for birth photographers, toolkits for new birth photographers to teach you how to photograph your own birth and step into the birth space for the very first time. We also have presets, we have mentoring, we have a whole host of things. So head on over to our shop at birthbecomesyou.com and you use code podcast25 at checkout. Thank you so much. All right. So we are excited to talk about this topic today. It's one that's like near and dear to my heart. And we're going to talk to you more about why birth photographers should be allowed in the OR, in
Absolutely.
every hospital, always.
Yes. We firmly believe that it's, 2024 and it is time for this to be the norm and not the exception. And I know that some of you listening are living in communities where it is the norm and you do go back into the OR frequently. And we know that there are others of you that are listening that you never get back into the OR and you have been fighting for years. So we want to acknowledge the wide spectrum. And for those who are working in birth, maybe as labor and delivery nurses, as midwives, as OBs, we want to talk about the differences across the country because I think sometimes when you work in the hospital system, it can be so insular and all you really know or see or hear about is what's happening in your hospital. And we want to bring awareness and say that, yes, like all across the country, at all different types of hospitals, in big cities and small cities, birth photographers are going back into the OR and they're being welcomed to go back into the OR. So we want to push the conversation to make some change. So we're gonna, I think it would be good to start maybe, Jen, with kind of our personal history with working in the OR. And we can talk about Denver because we both started in Denver. And Jen, when you started, of course, you had a cesarean section yourself. And then when you started in 2013, that time frame, what was it like for you in terms of getting back into the OR here in Denver?
It took a few years, actually. My first birth was in 2013, and I think I had 3 or 4 cesarean births between then and 2015, which was the very first time that I was in the OR. And that was at Rose, I believe. And was it Rose? I think it was Rose. Anyway, I was pregnant with my daughter, my second at the time. And I just remember thinking, like, what an incredible experience finally being able to be welcomed into the OR with like a lot of happiness and excitement while I was pregnant with my second and being able to kind of relive the birth of Magnolia because in a lot of ways you really think that you're so far and detached when you are laying on that table. The sheets there, the blue drape is there and you really can't see what's going on and it feels very far away. And so when I stepped into that space for the first time, it was really exciting to see that, you are giving birth. It's all right there. You just can't see it or feel it. And it's just so different. But the first birth was twins, and my client had been laboring all day for a really long time, was getting tired, but she was just ready to keep going. And I believe one of the babies was just having a lot of D cells, and the doctors felt like it was time to go back in the OR. And without any hesitation, the doctor was like, "And you're coming back too." And I was welcomed in. I was welcomed on the other side of the drape. So I actually was able to photograph the babies coming out of her body, which was incredible. And it was the first time skin to skin had been done in that hospital ever. And that was 2015. And we have photos of that. So it's really cool to see where that has come because you're in the OR pretty much at every birth all the time when you need to be.
Yeah, absolutely. I remember some of the very first cesareans that I did here in Denver. When I started photographing births, we got no more than we got yes. The vast majority of the time we were told, no, you can't go back into the OR. And there was one doctor, and if you live in Colorado, you probably know of this doctor, Dr. Hall. He is an older, amazing older OB who is one of the last OBs in the Colorado area to do vaginal breech births willingly for primates, for, singleton babies. And it's not surprising to me in a lot of ways that he is also a doctor that whenever I was at a birth with him and if the birth turned into a cesarean, even if everybody else was saying no, he would kind of come into the room and look at, the team and say, you know what, she's going to go back in the OR with us. I want her to go back with us. And he had such, I think, command and he had such respect within the hospital that they were kind of just like, okay, I guess she's coming back. And so it's
Mhm.
cool to me, I think, in both scenarios that we had the OBs kind of leading the way and saying, like, yes, like we want them to come back into the OR. And then, of course, over the last 10 years that I've been in Denver, it's been, I think, one of the coolest things that I've witnessed going from no, no, no to more and more yeses. And now I've attended cesarean births at every single hospital in the Denver area. And I go back into the OR probably like once a month, maybe once every other month. And obviously I I love it because I think it allows me to continue to tell my client's story. But most importantly, for my clients, like this can be life changing for them. Having a cesarean section, it's usually not anybody's first choice. And for some people, it's like their last choice. And it's really devastating to have to go back into the OR. It can represent a loss of their birth experience to them. And so being able to say, you know what, your birth story is still just as valid, it's just as important. You deserve to see how your body gave birth to your baby. You deserve to see your baby's first breath because no matter what angle you're laying at, no matter if there's a clear drape or not, it is really difficult to see what happens and how your baby is brought into the world. And by having someone there with a professional camera who knows the rules, who knows where to put their camera and where not to put their camera, who isn't going to faint or pass out like a partner might if they stand up and take pictures, a professional birth photographer can give people the gift of their birth story. And I think that's incredibly important and something that everybody on that person's birth team should be advocating for.
Mhm.
So we're lucky in Denver in that for the vast majority of situations and cases, I am able to go back into the OR. And a lot of that, I think, has been a lot of work by many people throughout the community and a lot of positive experiences with doulas and birth photographers, people coming back in the OR and making the experience better for the client and not causing any issues. And so I think that has moved the needle. And then, of course, once you start letting people in, it's really hard. Every hospital I go to, I say, well, I've been back in the OR here, and they can't argue with that. And so once you start making movements into ORs, it's a lot harder to no longer be granted access. How are things though in Michigan? Because it's different, right? In
It
Michigan.
is. It's very different. First, let me ask, like, how many hospitals do you think in the Denver area have you attended births in the OR? Because I there are multiple hospitals
Yeah,
here, just like there,
right.
and
I
I've
mean,
loved.
yeah, that's a great question. I mean, I've been to the University of Colorado. Obviously, we have multiple locations of the University of Colorado. I've been to those hospitals. I've been to Rose, which is like kind of the premier baby hospital. I've been to C-sections in Boulder, at Vista. I've been in C-sections at Swedish, obviously, with Dr. Hall. I've been in C-sections at Skyridge, which is a big kind of conglomerate hospital down south. So I would say probably at least a dozen different
Oh,
hospitals across the like metro Colorado, I mean the Denver metro area. So
mhm.
quite a few. And again, really wide, big university hospitals to small kind of community hospitals and everything in between.
Right. And that's kind of why I was asking, because there is only one hospital here that allows a second person to go back into the OR. And they have only done that in the last about year and a half. It was like, I think early 2023 when they finally got that approval and everybody kind of on board and willingly do it. But when I first moved here, it was kind of a slap in the face to be in Denver and being welcomed into the OR, and then coming here and I am spending, 20 hours with a client as both their doula and their photographer. And then sometimes we would have to go back into the OR and I was just not able to go. And not only is it hard it's hard for them, but it's hard for me as well because I can't continue to provide the care that I have been providing the whole time. Like this big piece when they need a doula the most, when they need photos the most, it's just not, it's not, it's not happening or it wasn't happening. And so the only hospital here that has even ever allowed it, I guess there's two, is the University of Michigan. And back in 2019, I was able to get in a couple times before the pandemic. And like you said, it was based on the OB advocating and seeing that I had been there with their client for a long time, or the amazing nurses that were like, this is something that the client really wants. So prior to the pandemic, I was able to get into U of M a couple times, and then another local hospital, they allowed me to switch out with the dad, which was difficult, but the mom wanted a few photos, so we were able to do that. And they felt like they were making a big consideration for that. Like it was a big deal to have somebody switch out. And then after the pandemic hit, it was just like a hard no all the time, everywhere. It was because of infection, or it was because of not enough space, or, really, there was no real reason. And then in 2022, 2023, the University of Michigan kind of had a lot of info. Well, what happened was the doulas in the area said, we aren't happy with this anymore. We really need to get back into the OR with our clients. U of M is a great hospital at allowing for change when the change is brought to them. And so patients wrote in, doulas wrote in to the hospital, and they had a specific person that they were writing to. And she got, I don't know, 20 to 50 letters about how, clients who had already delivered there or clients who were about to deliver there wanted their doula or photographer to come back into the OR with them. And so after they got all of that feedback, they made changes within their policy to allow for that. And they do it very openly and easy. Like, I mean, I was at a birth in January where they said no. And I was at a birth in April where they were like, yeah, you're great. Come on back. It's fine. Everything's fine. So it was like night and day, that shift when it finally happened. And there was no like, there's not enough space, which was told to us many times, or, you know, having another person in the space was going to be an added risk. Like none of that was even considered because probably none of that was really the real reason anyway, right?
Yes, no, I think that's a great point. And it's often the excuse that we get is that there's not enough space in these ORs. And, every time I hear that, I don't roll my eyes, but I do want to roll my eyes because there is enough space. We see students come into the OR all the time. We see first year nursing students. We see first year medical students come into the OR all the time. Yes, the OR is obviously it's not the most spacious room, but they are a lot bigger than the labor and delivery rooms that we're also allowed access into.
They're a
And
lot bigger than the bathrooms that I
yes,
stood in. And, like,
yes, yes.
I
Birth
mean,
photographers and doulas, anyone who works in birth knows how to do their job in very small spaces and in spaces that are much smaller than an operating room. And so, I think that there's usually a list of reasons like, they talk about sterility, they talk about the size of the OR as reasons. And I think that at the end of the day, we have to push back a little bit. And I loved your story, Jen, because what I heard is that it was a it was a group effort, right? It wasn't just the doulas, it wasn't just the birth photographers. It was clients and patients going to the hospital and saying, this is not working for us anymore. I've seen that make the biggest difference in my own personal experiences as a birth photographer in the earlier years where we were getting a lot more no's, what made the biggest difference was my clients and the patients of the hospital saying, no, I'm sorry. I'm not going to take that as an answer. There's no reason she can't go back in the OR. I want to talk to somebody else. And it was my patients who advocated for themselves that were able to really push the I think, and push and change the entire culture because they didn't have a good answer as to why somebody that is trained, that's professional, that understands birth, that understands the sterile field, why can't this person come back into the OR? In many ways, we can be a more trusted, and I say trusted in the sense that we've seen birth before. We have seen cesarean births before. I've had partners come back in the OR and get really queasy and need to sit down because they're about to pass out.
yeah.
We're not that same level of risk. And in many ways, we can kind of help both partner and our clients understand what's happening. Let the anesthesiologists do their job, let the surgeons do their job. The nurses aren't over there near the patient, usually when the cesarean is happening. And so it's really, I think, helpful and meaningful to clients, patients to have someone that they know and that they trust right there next to them, documenting, explaining, and providing emotional support during what can be a really scary experience for a lot of people. If you're a nurse, if you're an OB, you see cesarean sections all the time. But if you are a patient or a client, this is often your first time or one of the few times that you are in an operating room like this. And it's incredibly frightening, even if it's a very normal, routine cesarean section. And having your support team there can make such a big difference in patient satisfaction. And as we all talk about, yes, we want a healthy mom, we want a healthy baby, but we need to be striving for more. We need to be striving for for patients leaving feeling like, their heart, their soul, their mind, their body, all of that was protected during the birth process. And a
Mhm.
simple yes can make a huge difference for people.
Yeah. What if we say yes? I mean, really, there's so few good reasons to say no. What if we just say yes and allow families to have what they need in the space when they need it the most? And I think that's just, I don't know, the biggest takeaway from all of this is what if we just started saying yes when families were asking for what they need? Like what if we said yes to a birth that is like good for your mental health, that's good for your nervous system, that you can leave the hospital, just like you said, feeling like that was a really great experience rather than feeling like, oh my God, I never want to do that again. Because that's hard. You remember your birth your whole life. That never goes away. I still think of my oldest daughter's birth and, being scared going into a C-section. My second daughter's birth was a VBAC. It was still long, it was hard, but it just didn't have that fear factor of being wheeled into surgery. And I had actually never even been a patient in the hospital before that time and wasn't planning on being in the hospital. I was planning an out of hospital birth. So for me, not only was that day like the first time I'd ever been a patient since my own birth, it was the first surgery I'd ever had. I mean, just like you said, it was scary. It was intense. And you do want somebody. And I want to say, I had Dr. Hall was my surgeon that day. You talked about Dr. Hall. He actually was my surgeon, and he allowed my doula to come back with us. And I can't even imagine not having her in that space. And he just said yes right away. That wasn't an issue. And I didn't even know at that time what
Right.
kind of an issue it was.
Right, right.
Yeah,
I mean, when you think about, for folks that are having a cesarean section, it's often because, a lot of the reasons, a lot of the choices, a lot of the things they wanted for their birth didn't go the way that they planned.
exactly.
And this is like one way for you to say, okay, I recognize like this is not your plan A. This was not what you came in here wanting, but I am still going to do everything that I can to make this experience as close to your original birth plan as possible. People are investing thousands of dollars in their doulas and their birth photographers. And I don't think a lot of times nurses or doctors even understand the financial investment that people are making in having their birth documented. So you can imagine your birth plan goes sideways, you're not getting the vaginal birth you had hoped for. And then suddenly the birth photographer that you had spent a lot of money and time bonding with, this investment you had made, they're suddenly saying no. And for a reason that is honestly not, it's not accurate. Because I mean, I'm telling you, if birth photographers like myself, like other birth photographers, are going into ORs all across the country and are not causing sterile issues, are not causing any kind of big issue,
Right.
then there's no good reason why you can't allow a birth photographer or a doula, or for goodness sake, the person's sister to come into the OR. During COVID, this was so frustrating because they would say things like, well, the partner can go back. Sometimes the partner is not the person that the birthing person wants to have next to them during birth. That's just the reality. And so, it's really hard. I mean, what are you going to say? I have to choose, the father of my baby or my sister to go back in the OR. Maybe the sister is the one that's providing more emotional support. Maybe the doula, maybe the birth photographer, but they can't say no to the father. I mean, it's just such a complicated it puts the birthing person in such a complicated scenario. And I think just being able to say, yes, you can have the father of the baby, and then you can also have whoever the partner that the person that you want to come in with you can also come into the OR. I think it's an easy way to make their birth experience so much better.
It absolutely is. And I just want to say, like, we were kind of talking about, just saying yes. And I was like, I had the honor of photographing a maternal assisted cesarean birth here recently. And that had never been done at this hospital before. And it's not really done in the United States very often. And when my client presented it to her statement to her OB was like, just hear me out. Don't say no, just hear me out. And instead of, she didn't say no, she said yes. And she said yes every step of the way and made all of this happen for my client who had a really difficult and traumatic first birth and needed a cesarean birth with her second for a medical reason. And she allowed her to like be a participant in her own birth, to have her birth photographed. She was able to see her own birth. She was able to pull her own baby out and put her own baby on her chest. And it was all because one doctor said yes. And just made it work all across, with nurses, with anesthesia. She did all the things that she needed to make it happen for her patient. And I just think like we need more of that. Like you can make change if you're a doctor listening, if you're a nurse listening, you can make change in your own hospital right now. And I think that's just a really important piece of this is just being on board and recognizing like this is what your client or patient wants. So making it happen for them is only going to benefit them and you really because they're going to be so grateful. They will think about that. I think
Absolutely.
about the time, my births were hard, but anytime anybody said yes, I remember those yeses. Like, okay, I can have Anne, my doula, come back with me. Or, my midwife was in my room with the second and Monet and Josh. And I could have had my daughter there if I wanted. Like, there were a lot of yeses that were happening. And it was nice to have that. It
Absolutely.
makes a difference. You think
It
about
does
that.
make a difference.
Hmm.
And if you are a healthcare professional, like we would really encourage you to think about the policies at your hospital and ask yourself, who are these policies serving? Are they serving the hospital or are they serving the patient? And I know that anyone that gets into birth, anyone that gets into labor and delivery, you're doing it because you want to take the best care of these families and you want them to walk away with, intact birth experiences and you want them to feel good about their birth. And so if you can be the one that starts to question some of the policies at your hospital, then do it. We know that yes, there are some policies that are evidence-based, but a lot of them are not. And why are we still holding on to those?
Yeah, exactly. And, just knowing that, taking some steps forward is going to snowball into a bigger effort. I think that's a piece of
Absolutely.
it as well.
I think it'd be good, Jen, to talk about what, if you are a birth photographer or a doula and you have a situation in which your client needs a cesarean, how can you help advocate for going back into the OR? What are some steps that you can take? How would you handle that situation? I think the first thing that I tell all of my clients is that the number one person that's going to make a difference is going to be them. If they can advocate for their birth, if they can advocate really strongly and not take no for an answer, that often makes
Mm.
the biggest difference.
Yeah. That is always the first thing that I say. Like, I can share, I can amplify your voice in these moments and I can say what you're saying, but it's coming from you. And that's really going to make the biggest difference. And that's how I was able to get into the OR in those very few times before COVID at U of M, where my clients were just like, no, she's been with me for 20 hours. Like, how can you not let her continue this process along with us? And I think that really, I mean, it really did make a huge difference. Also, just sharing like a little bit of like what you've invested into this. Like my birth photographer costs $2,000. I really want them there with me. I think that was something that you taught me, Monet. And I said that to a nurse or something once, and you could see kind of like the light bulb go off like, oh, this is like wedding photography and not letting your wedding photographer be in the room. And so she actually shuffled out of the room and came back in and then changes were made and it happened. So, I think just sharing the investment and the commitment. And
Yeah,
like you said, like we've built a relationship with our client. Like this isn't the first time usually that we're meeting them. It's definitely not the first time we're talking to them or communicating with them.
right.
We know their wishes. We know what they want. And so being taken away in that like I don't know, really pivotal time, I think is really difficult for clients.
It is. It is. And I don't think people understand, especially, if you're seeing, like we said, dozens and dozens of C-sections all the time. It really matters. These birth images help people piece together their story. It can provide closure, it can provide answers, it can provide healing. I had a client recently who was attempting a VBAC, and after many, many, many hours, she ended back in the OR, but I was able to go back with them. And I took images, and the tears on her face when her baby came out, her baby cried and was super pink and vibrant right after she was born. This was not the case with her first baby. It was so powerful. And she looked at the images and she said, "You know what? Like I really wanted this VBAC, but at the end of the day I realized I needed to come back into the OR to have this healing and redemptive experience. And these images mean the world to me." And it was obviously so moving to hear, but I think it really underscores the importance of letting our patients, letting our clients make as many, if not all, the decisions they can about their birth. This is their story. This is a story they will carry with them for the rest of their lives. You likely won't remember this in great detail, in the next week, month, year, but they will. They'll remember every single moment. And giving them the gift of their birth team and their support team is huge. When I talk to my clients and when I'm in this situation, there's always three people that I'm thinking about. It's the charge nurse, it's the nurse that I'm working with, it's the OB, and it's the anesthesiologist. And you really have to get all of those people on board. They say that the anesthesiologist makes the final call, and they often do. But I've seen OBs and I've seen charge nurses step in and alter things for good or for bad. And so those people need to be on your team too. So it's about being professional. Introduce yourself. If you can explain that you are a trained professional birth photographer, that is going to be a lot more reassuring than just some random person they don't know with a camera. If you can talk about how you've attended many births and that you are, someone that is very comfortable in the birth space and you understand the sterile field, using that terminology can help them realize and recognize that you are a professional. And then, if you've been in cesareans, reference that. I always tell folks, I've been in dozens, if not hundreds of cesarean births. I know what I'm doing and I know how to listen to direction. Some OBs and some teams are really comfortable with you moving throughout the room, and other teams want you to sit and not really do much besides wait for that drape to come down. There's a spectrum, and I wish that we had full access in every OR, but we need to be making small steps forward. So if you get back into the OR, talk to the charge nurse, like ask questions. Where can I stand? What are you all comfortable with? Make sure that you're paying attention and that you're not like just, randomly moving throughout the room, because what we don't want to see happen is people go back into the OR and then a bad experience or a bad situation happen, and then suddenly everybody loses out, right? It takes one bad experience to really change decisions by the team. So I think that is probably like my biggest advice is to make sure that you connect with all three of those players, the nurses, the OB, the anesthesiologist. And then if you do go back, really make sure that you are part of that team. Listen to them, respect their boundaries, be professional, and move it forward, not only for yourself, but for your whole community.
Mhm. And it's really not that hard to like fluidly move in that space. I mean, maybe we should briefly even just talk about what that space looks like if you've never been in the OR so that you can have an understanding of what you're stepping
Yeah,
into if you get into that space. But you're generally at the head of the bed by the person giving birth, and the partner is generally back there with you, usually in a chair. And then at least on where I'm at, the anesthesiologist is right there behind me, and then the nurses are kind of on the sides. They have like their little area on the side. And so you're just moving in this very tiny space between like the right side of your client's head, the left side of their head, the middle of their head. And
right.
maybe if you can squeeze over, I can sort of get like my whole client's body. But I don't have any other space on the right side at all.
No,
And I'm generally kind of doing a dance with the anesthesiologist, and they're really pretty good about it.
they are.
We just talk to each other. It's been a really lovely experience in the last year just because everybody's so on board. Like, this is just policy. So, this is just what they do, and they're really fine with it. It's been really good. And I've noticed the younger anesthesiologists are, the more they can kind of see the value in what we're offering because they are having children at that age too. And they're like, oh, wait, yeah, I can see how my
Yeah,
wife might want pictures of this or my partner might want pictures of this. So
absolutely.
I do think that I just think with the younger generation, I mean, we've been doing this for 10 years. Like,
Right,
we have this whole new generation of anesthesiologists, nurses, and people who see the value in documenting their lives.
right. And I think that it's worth having the conversation too, because you see these beautiful, and we share them, and sometimes we take them, these really beautiful C-section images where you're able to get like, document every moment of the surgery. And some providers aren't comfortable with that, and you need to ask questions. Like, don't be afraid to say, hey, like, when are you okay with me photographing? And some providers might say, I'm okay with you photographing the entire time. And others might say, I'd prefer for you to wait until the baby gets out. I did a cesarean section at the University of Colorado, and they were very on board with me going back into the OR. But then once we got back there, they had a resident doing the surgery. And I think she was relatively young, or maybe in her first couple years of residency. And the assisting doctor was like, you know what, like, I don't want you to photograph until the baby's out. And of course, I wish I would have been able to photograph the entire thing. But again, it's all about like, let's respect their boundaries, push back when we need to push back, but also understand that it is surgery. This is surgery that they're doing. And it is, something that they're very confident and comfortable doing. But if you're a new resident, you might not have that confidence yet. And so let's be respectful as much as possible. Let's give our clients the best experience that we can while also working in a space that is, it is surgery, it is an operation, and we have to keep that in mind. There's a drape that's going to be up. And you can, I often will hold my camera up and shoot down, but I'm never holding my camera over the drape, right? So but my camera is always staying on the side of the patient, myself, the partner, the anesthesiologist. So make sure that you're not ever moving your camera over that blue drape. That will get you into a lot of trouble really quickly. And again, moving around, it's not the same as being in a labor and delivery room where you can kind of move around quickly and freely. You really often are kind of in that back area. And occasionally you'll have a provider and a nurse that will say, yeah, you can come around this way. But I think that's honestly the exception and not the norm. And so I would not walk in that direction without making eye contact and getting verbal approval that you're allowed to go on that side of the drape.
Yes, absolutely. And I think you kind of brought up like being respectful. Let's just like talk about that for a minute because I feel like sometimes hospital staff maybe thinks that we're not going to be respectful or not going to get out of the way or not understand, an emergency situation. And that's just not the case. I mean, if anybody, says anything like, well, I need you to move, this is important. Of course, that's exactly what I'm going to do. I'm going to do whatever they tell me to do in the moment because
Right.
that's what I would do in any situation if it's an emergency situation. And
Right.
I just feel like maybe that is something that needs to be said because I don't know. Maybe it does though at this
No,
point.
I agree, Jen, and I think
Yeah.
sometimes there is a lack of understanding of how much skill and training and dedication birth photography takes. It is not a hobby, mainly because it is so difficult to be on call. It is so demanding to be on call. The people that are choosing this line of work are I think, some of the smartest, brightest, most intelligent people that I know because we're balancing so much. We're
It's a
balancing
lot.
being on call 24/7. We're balancing really disparate birth situations. We're balancing, clients that, we go from one birth where, we're in the OR to the next birth, we're at a home birth. Like, we're going in these really wide disparate, birth situations. We're doing all of this, and we're also carrying like really expensive camera equipment and, working with really difficult lighting situations. So all of that to say is that we know what we're doing, and we are very willing and able to listen to directions. And we also
Yeah.
understand the birth process really well. I can tell
Mhm.
when there's an emergency. I can sense it in the room. I can feel it. And we are the first ones to step back, to help, to offer support. We are not there to get in the way. We are not there to make it about ourselves. We are always going into births with our client at the center of that story, not our
Mhm.
own selves, not our pictures, not our photographs. It's the client and the client's experience. And so we're doing everything we can to keep that sacred and to protect that space.
And our whole job is really observing what is happening. And
Yeah.
so we're very in tune to what is happening.
Yeah.
I mean, I can see the shift in the nurse's face if something is happening, or that look that the nurse maybe gives the OB in that moment, or whatever. We know, and most of us are doulas. I think I think the last time we polled our groups, we found that over 50% of birth photographers are trained doulas. So these are birth workers. Like, we are going into this space knowing birth and wanting to be in the birth space all the time because that's literally our job. Like, that's
Absolutely.
what we're doing.
Absolutely.
So,
Yeah. And I mean, I would love to, it would be really cool, Jen, to kind of pull our community and get a list of all the hospitals across the US, maybe to start with, but all the hospitals that are or have allowed
oh, I love
photographers back
this.
in the back in the OR, because it would be really, I think, a really cool resource to show hospitals that maybe weren't doing that, to say, well, hey, like, take a look at this list. They're going to recognize those hospitals. They probably
Mhm.
have colleagues from medical school that are practicing at, the University of Michigan or the University of Colorado. And that might make them think, well, wait a second, if there's literally hundreds of hospitals on this list, then maybe us saying no is no longer the status quo. Like, maybe we are kind of behind the times right now. And so
Mhm.
I think it would be cool to compile that, because I
Yeah.
know that change is happening. I hear about it in doula groups. I hear about it in our own community. More and more
Mhm.
people are getting access back into the OR, and these images and that support can be so life-changing for these patients and for these clients. And
Yeah,
it's worth fighting for. It's worth
it really is.
or, and if you are in a community where, it is a struggle, then yes, obviously in the moment, have your client advocate, but then start doing some advocacy within your community, get people to write letters, get doula groups to set up meetings, like do some
Mhm.
groundwork
Do the groundwork for it. Yep.
before you're in the situation where your client needs a cesarean, but start pushing, I think, the conversation and making these hospitals really consider some of these outdated policies, because they're outdated. I mean,
Yeah.
that's simply what they are. They're outdated, and
And
they're
yeah.
not serving anybody at this point.
Exactly. And having a list helps all of these patients across, the country being able to look at the list and say, okay, I could go to this hospital, but this hospital lets my doula or my photographer back
Right.
if I have to go
Right.
in for a C-section. So
Right.
I'm going to make this choice. And we are
Yes.
seeing that 100% here. This is, the University of Michigan is one hospital that is doing this. There are probably, I would say, 20 hospitals within 1 hour radius of U of M. And people choose hospitals based on where they live, but people will drive to U of M for water births and people will drive to U of M for this. And if these other hospitals don't get on board, they're going to see, that shift. I have absolutely no doubt that they will see a shift in their clientele.
Absolutely. Absolutely.
I mean, we saw that happen in Denver.
Yeah.
It was like, okay, if this hospital's doing it, we're going to this hospital because there's so many hospitals. Like, you can choose between Sky Ridge and Castle Rock if you
Right.
live anywhere in there.
Right.
And so if Castle Rock is allowing it and Sky Ridge is not, they either get on board or they lose out on clientele. So, and I think I mean, it was obvious when it was happening in Denver. So I really hope that we start seeing that here. Like
Absolutely.
I like if you can't tell, it's something that I just am really passionate about. I just think it's so important, both as a patient myself who went through this, who like didn't feel like they were part of their birth experience. And had I had photos, and I probably could have had them, my doula was allowed in. We just didn't think of a lot of those things in the moment. It was
Right.
just very kind of rushed and not well thought out. So
Right.
I just think what a difference, that would have made for me rather than, just hearing people have a conversation about their day.
Yeah.
And here I am trying to like have a baby and have a birth and
Yes.
have an experience. So I think it makes the biggest difference. And it blows my mind that like 12 years later, we're kind of still doing the same thing as we were doing then. I mean, even
Right.
10 years ago, right? Like that's really 10, 11 years ago is when I got into birth. It's the same thing. It's the same kind of fight. And I'm glad to see that it's finally shifting in other areas. And
Yeah.
hopefully it continues.
Hopefully it continues. Yeah. And we'll definitely, the Birth Becomes You team will work on compiling that list of hospitals across the country because I do think it would be a really good resource and a way to hopefully get these, hospitals that are, refusing to budge to start to think like maybe we need to change our policy to better
Mhm.
reflect what patients deserve and what they're asking for during this time. So yeah. And, just so people know, like in our Birth Becomes You, we have an Essence of Birth training where we've trained, hundreds of birth photographers. And we have a nurse come in and talk about the sterile field. And we, talk about what it's like to go in the OR. We are
Mhm.
trained professionals. We are not coming in there to compromise anyone's safety. We're there to document, our clients' most important day, the day that they meet their baby. And everyone deserves images of that if they want them, no matter if you're giving birth at home, if you're giving birth, in the hospital in a labor and delivery room, or if you're giving birth in the OR. We all deserve to have everything that we can safely have for the birth of our babies.
Yeah, exactly. Well, do we want to talk really briefly about a when would you go? Because I have one
Oh,
that's
yeah.
kind of interesting and maybe we'll see. I don't know. We'll go with this. So, we talked about my maternal assisted birth today. And so, we're going to talk about that. So, I'll give you the backstory. The client had a planned cesarean birth scheduled so that all of this could happen right around 39 weeks. So, when did I go to that birth, Monet? Any ideas?
Oh goodness. Well, I know a little bit about this story, so I feel like
Right.
kind of like,
But I feel like
but
you'd
I would
probably
say,
be able to say, well, you'll go at either 39 weeks or when they
yeah,
call you in labor.
I honestly like I'm pretty lucky and like probably my luck will change, but most of my scheduled C-sections do happen on their scheduled date. So
That's
I am not
funny.
getting many like I'm in labor early calls, but of course I'm sure that will all change now that I've said that out
Mhm.
loud. But I would guess that you got a call earlier to go into
Oh,
like
yeah.
yeah, yeah.
And that was really the concern, right? Is that all of the team wouldn't be able to be there because this was scheduled. This was scheduled with very specific people, nurses, anesthesiologists, everything. So of course my client's water broke at a week before, maybe I think it was 10 days before her scheduled cesarean birth, and it broke in the middle of the night because that's when we go into labor, right? So she called me kind of in tears at like 1 or 2 a.m. I'm really sorry my water broke, and I was like, you don't have to be sorry, this is what I do. Like this is literally what I do. So we all went, and she was able to have part of her team, including her OB, there. She called her OB, and her
Oh,
OB came in. And then it just so happened that like the right people were on shift, and anybody else just said yes because they made it happen.
right.
And so that is kind of how it worked out. She had a great birth, but it all happened, before it was planned, not on the scheduled date. And all of it still happened without a hitch. So,
Wow.
all of that to say, it can be done. It can be done even if it's not scheduled.
Right.
Scheduled, birth happens when it happens. And so you have to be, ready to change and shift when, when that happens. So,
Absolutely. I love that
yeah.
story. Yeah. And, I think it like just speaks to like the beauty of like, what if you just say yes? Like, what if as a provider you say, yes, like this is something that's really important to you. We're going to do everything in our power to make it happen, especially something that is really as safe as just having a trained birth professional come into the OR and stand next to the partner. This is not something that's super risky. This is not something that's super, in my mind,
Exactly.
dangerous. It's not going to, yeah, it's not going to impact the providers that much. If anything, it's going to make the client and the patient have a much better birth experience. And I know that's what we all want deep down. So
Mhm.
just say yes.
Just say yeah.
Yeah.
And we're going to share a link in the notes and on our website podcast page, which is birthbecomesyou.com/podcast. But we're going to share a slideshow with photos taken by other photographers, me in the OR. And this was actually something that I created for a birth art exhibit, but it's all about, being asked to come into the OR and providers just saying yes, and how it has made my clients feel, and how their birth experiences have felt different because of that shift. So we'll include that as well.
Love it. Yeah. Well, thank you guys for being here. Thank you for dealing. I had kids screaming during this. So thank you for
I couldn't
understanding.
hear the kids at all, so
Oh,
that's good.
good. Well, I was
Yeah.
like over here having like panic attacks as they were. I think Ryan actually took them out of the house because it was getting a little out of hand. But thank you for your patience with any weird noise artifacts. But we're so grateful for our community and for you listening. And we would love for you to reach out to us via email or on socials. If you have a topic suggestion or if you want to come on to the podcast, we can't wait to continue to do this with you. Thank you.
Thank you. Bye. Thanks for tuning in. Find out more about us, our courses, and other tools for birth photography at birthbecomesyou.com. And make sure to follow along on Instagram and Facebook at Birth Becomes You. And if you love listening, make sure to give us 5 stars on Apple Podcasts and subscribe wherever you listen. Thanks. Catch you on the flip side.